Hello, everyone. Welcome to Congressman Colin Allred's telephone town hall and briefing on the response to the coronavirus. My name is Josh Stewart. I'm a North Texan, and I'm Congressman Allred's Communications Director. To start, I want to point everyone to visit allred.house.gov/coronavirus for resources related to helping you navigate this crisis and how to stay healthy, and various links we'll be referencing throughout the call. Next, we'll be hearing from Congressman Allred, as well as local leaders and experts shortly, but I want to make a few announcements. It is Congressman Allred's top priority to listen and hear from you. If you would like to stay up to date on his work in Congress across the 32nd District, please press *6, and we can add you to his newsletter. To put yourself in line to ask a question, please press *3. We will have a lot of questions today, and if we don't get to your question, please know we will respond to the message in writing, and at the end of the call, everyone will have an opportunity to leave a voicemail and potentially ask a question in a voicemail. We'll be getting back to those as well. Now, I'd like to hand it over to Congressman Colin Allred to get started.
Thank you all for joining me. This is Colin Allred. Tonight we will be joined at some point, when he's available, by Dallas County Judge Clay Jenkins, Dr. Huang, the Director of the Dallas County Health and Human Services. We're also joined by Dr. Trish Perl, the Chief of Infectious Diseases at UT Southwestern, and Susheel Kumar of the Small Business Administration, who can help with questions for our small businesses out there. I want to thank Judge Jenkins and Dr. Huang for their incredible leadership in Dallas County during this difficult time. Soon, the entire state will be under a similar order to Dallas County Stay Home and Stay Safe order, and I believe that these steps are necessary to make sure that we all stay healthy, and want to thank all of our local and state leaders for the tough decisions that they've had to make. This is a very serious time for our country, and I know many of you are worried. This is one of the greatest challenges we've ever faced as a state and as a nation, and it's going to take a united front for us to win this fight. This is not unlike wartime, and we are at war with this virus, and we're all in the fight together. The coming weeks will be the hardest that we will face as an area and as a country. We will see more positive cases, we will lose more of our neighbors, and the full economic impact will hit home as more bills become due and families feel the strain of the financial burdens. Last week, Congress passed the CARES Act, a $2.2 trillion bipartisan economic relief package, providing historic investment to combat the coronavirus pandemic and to support North Texas families. I want to begin tonight's call by talking about how this bill will affect you. I know many of you have heard about the direct payments. I want to explain how they will work. The CARES Act includes direct payments of up to $1,200 for an individual, $2,400 for joint filers, as well as an additional $500 for each child in those households. The direct payments phase out for incomes above $75,000 per individual and $150,000 per household. For Social Security recipients, your Social Security income will count towards that $75,000 income threshold. Direct deposits will begin to go out the week of April 13th, and checks will go out a couple of weeks later, beginning with low-income filers. In order to receive a check, you will have to have a Social Security number. The goal here is to leave no one behind, but I realize that inadvertently some loopholes were not closed, and we are working to fix that. For those of you who have lost your job, we've dramatically expanded unemployment insurance with a $600 increase and 13 more weeks in unemployment benefits. The goal here is to replace lost wages for the average worker for up to 4 months. If you are a gig economy worker or self-employed, we have also expanded the criteria for benefits, and you will likely qualify, so we encourage you to apply. If you have any questions about unemployment insurance, you can reach out to my office or to the Texas Workforce Commission. I know there have been some issues getting through on the phone and the website to the Texas Workforce Commission. My office has reached out to them. They recommend visiting the website early in the morning or later in the evening when traffic is lower. All of this information is on my website at allred.house.gov/coronavirus. The CARES Act also provides $377 billion in investments for small businesses to help keep our business owners open and to get them back on their feet. We're here to help if you have any questions about these programs, so please give us a call if you need assistance. But here are a few highlights for small businesses. We have made rent, mortgage, utility costs eligible for SBA loan forgiveness. We've included $10 billion for SBA emergency grants of up to $10,000 to provide immediate relief for small businesses' operating costs. There are $17 billion for SBA to cover 6 months of payments for small businesses with existing SBA loans. And there are several types of loans and assistance, including the Economic Injury Disaster Grants and loans that Mr. Kumar will talk about, the Paycheck Protection Program that I can discuss, and the Small Business Debt Relief Program. My office has created a guide specifically for small businesses to help them through this difficult time. And you can access that guide by going to allred.house.gov/COVID-19 small business. It will be updated periodically as new resources become available. The CARES Act also includes vital assistance to our workers in North Texas industries, like our airlines and airports, who have been hit extremely hard. We've provided some relief for federal student loan borrowers, suspended payments and waived interest and penalties on federal student loans, and the tax deadline has been pushed back to July 15th to help taxpayers. These are no doubt just the first steps of many that will be taken to mitigate the pain and economic damage that is going on. There are heroes right now in our community who are risking their lives while they are saving others. Our healthcare workers, whether they be doctors, nurses, first responders, are lacking in the equipment that they need to do their job, and we are far behind where we should be in our capacity to test for the coronavirus. That is why I've urged President Trump repeatedly to fully utilize the Defense Production Act to help mitigate any supply shortages by directing the domestic production of equipment that's in short supply. Using the authority under the Defense Production Act, we need to marshal every resource we have to produce the needed supplies and to respond to this pandemic. We are severely limited in our testing capacity, even though Congress has provided billions of dollars to ramp up testing. And it is inexcusable that this administration has not done more to get us to where we need to be. If we're going to overcome this crisis, we're going to have to dramatically increase our ability to test and isolate those who have been infected, and we're going to have to stick to the measures that have been put in place by Dallas County and now by the entire state. Again, this is Congressman Colin Allred. For those of you who are just joining, thank you for joining this telephone town hall. Please press *3 to ask a question, and one of my team members will take your question. If we don't get to everyone, my office will respond in writing to address your question, and you can leave a voicemail at the conclusion of this call. Now, I'd like to hand it off to Dr. Huang, who will give us an update from Dallas County's health perspective.
Sure. Thank you, Congressman Allred, for all your leadership on this and support for everything we do. I'm Dr. Phil Huang, the Director with Dallas County Health and Human Services. We've been in this from the start, have been doing all the identifying the cases of COVID-19 and interviewing them, doing contact tracing. We have our epidemiologic staff that have been working late into the nights and every weekend day for the last several weeks trying to keep up with this. Our latest numbers, we had 100 new cases reported today, so our total in Dallas County is now up to 731. Today we also reported our 14th and 15th deaths, and we've been monitoring. One of the things that we've noted that the actual number of ICU hospitalizations from COVID-19 from this past week has now exceeded the peak week of our ICU hospitalizations from the entire flu season this past year. Again, the numbers are increasing. We are continuing to do those contact tracing as well as, work with Judge Jenkins and the other staff on implementing some of the judge's orders that I'm sure he'll talk a little about that are the next phase of this, which we've said, we know how this is spread. It's spread from person-to-person contact, droplet transmission, but that physical distancing is one of the key things to slow down the spread of this illness. And what we're trying to do with that is, protect our vulnerable populations, those that are most vulnerable to severe illness, those older persons with chronic underlying health conditions, and as Congressman Allred said, that importance of protecting our healthcare system, our healthcare workers in the front lines, and our first responders, and all of them. And so, again, we've been working on many fronts now, where we are still doing the containment at the same time as doing these mitigation efforts. But the last thing I just say, we've talked about it all throughout, but don't forget these basic, simple things to do. Wash your hands, don't touch your eyes, nose, and mouth, cough and sneeze into your sleeve, stay home if you're sick, absolutely, and then, clean the surfaces and things that are frequently touched. But I'll leave it right there and look forward to questions later.
Thank you, Dr. Huang, for that update. Again, this is Congressman Colin Allred. Thank you for joining our telephone town hall if you were just now getting on. Dr. Perl, if you're available, could you give us an update on this virus?
Yes. So hi. My name's Trish Perl. I'm the Chief of ID at UT Southwestern. I'm a practicing infectious disease clinician, and I've also worked on a lot of coronavirus outbreaks, including SARS and MERS-CoV. And I'm currently working on the COVID response here on the medical campus in Dallas. And I've been charged with telling you a little bit about this virus. It is a round RNA virus. It's very pretty, and it's called corona for the crown that goes around it. It actually causes the common cold, and everyone on this phone call has probably had it. And it's responsible for about 30 to 40% of upper respiratory tract infections. In terms of illness, we're seeing anything from people who have minimal to no symptoms to people who have very, very severe disease, and as you've heard, end up in the intensive care units. And actually, unfortunately, we've had deaths associated with this virus. The people who are most vulnerable to the virus, or at least to the complications of the virus, are the elderly, people with diabetes, people with heart disease, and so really the traditional groups that we worry about. There are no treatments that are known for this, although we are using therapies that look like they work in animal models, and are actually drugs that we use a lot for other diseases. There are some medications that we use for malaria called chloroquine and hydroxychloroquine that is used for lupus, that again are experimental, but that we are trying in these illnesses. There are also some immunomodulators that are the kinds of drugs that would be used in rheumatoid arthritis that are also being tried. At UT Southwestern and Parkland, we actually have several experimental or clinical trials going on with additional drugs. So we're really trying to pull all the stops out as part of that pillar to support the public health infrastructure and the public health response for this disease. The most important thing you guys can do is really prevention. I think Congressman Allred has really already highlight a lot of this, but I can't emphasize the importance of hand hygiene. Just washing your hands can decrease transmission from respiratory viruses by 50%, especially if you do it a lot and have everyone else around you do it. We also encourage social distancing, or physical distancing as we're calling it now. That just prevents you actually being in the pathway of how the virus is transmitted. It's transmitted by respiratory secretions, so essentially how much I can cough or spit, which is about 6 feet. So if you distance yourself, that's why we're saying 3 to 6 feet. We want you to clean the surfaces and clean your house like your mother told you to. This is not a very strong virus. It's a wimpy virus, and so most common household disinfectants will clean it and kill it. And so we just really want you to sort of focus on what we're telling you. We can't emphasize how important it is to really help us decrease the number of cases that we're going to have and the burden on the healthcare system as well as the public health infrastructure. Thank you.
Thank you so much, Dr. Perl, for that information. And Dr. Perl and Dr. Huang will be on the call for all of our questions. Again, this is Congressman Colin Allred. For those of you who are just joining this town hall, you can press *3 to ask a question. Judge Jenkins, are you available now?
Can you hear me?
Yes, we can, Judge.
Oh, great. Yeah, I can hear y'all. I'm sorry I was on another call that it was urgent, and so I'm a little late getting on this one. Thank you, Congressman Allred, for doing this. It's very important that we give the public as much information as we can so they can make the best decisions to keep themselves safe. Do you want like since I wasn't on in the beginning, I don't know how much.
Sure. Well, if you could, Judge, just maybe give us a quick overview of how things are looking, and thank you again for all of your leadership.
Thank you, and I think you're doing a fantastic job. We're lucky to have you. So on the good side, on March 22nd at midnight, Dallas County became the first place to have a safer at home stance with my executive order. In the days after that, Harris County, shortly, like 1 or 2 days after that, Harris County, El Paso County, Bexar County, and Travis County, and I'm probably leaving someone out, but 5 counties began to lead the state, and I'd already been asking the governor before then to do this statewide, as had our hospital systems. The good news in the fight right now is that Friday at midnight, or Friday, first minute of the morning, the state will now be under the Dallas County safer at home model, and that gives us our best chance to flatten the curve. We are seeing more cases, as Phil probably told you, 100 new cases today in Dallas County, 2 new deaths, more nursing home spread cases, which are very difficult and problematic. But these are things that we expected. We know we're just at the beginning of the curve, but I'm so proud of our community. Our hospitals are serving under a unified command posture with my special assistant for unified hospital response or healthcare response, who 6 months ago was the chief of staff to Health and Human Services in the Trump administration, but has come back in a bipartisan fashion to serve as my assistant on this matter without pay, leaving a multi-million-dollar job as the head of hospital consulting for Alvarez and Marsal. We've got CEOs, the second in command of AT&T, and former chair of Hill Knowlton doing important jobs. We've also got a council of union and worker groups that look at all these worker protections that we're passing each day. We've got doctors and pastors from all walks and all areas of town and all races that are all working on equity issues each day. And then we have a team of about 20 people that are working 19-hour days to keep you safe, as well as a great first responder community, a tremendous healthcare community, and not to forget our grocery store, trucking, and other heroes in essential business. So I do feel good that we have our best stance to take this on. It's a race. As I was talking to the congressman yesterday, we're dangerously low on PPEs. We don't have enough ventilators. It's a race for us to acquire those life-saving tools and to flatten that curve so that we don't have more need than we have assets. And it's a race that we can win. It's a race that the probabilities were not good with Collin County not being in a safer at-home stance, but that's going to help a lot. And we're making some good progress. So, what I would ask everybody on this call, same thing I ask my teams on the calls I have throughout the day. As a community, we have to move from fear to faith, and not your own personal faith only. I'm for that, but faith in the science. As you make your personal responsibility decisions, it has to be based on those CDC guidelines, which, by the way, you can now find at our website that's up to date, Dallas County COVID, which has a ton of information, and DallasCountyCovid.org, which has a ton of information and will allow you to communicate directly with us with any concerns or questions or comments that you have. And we'll be able to put those on a Google document that we can get to your information faster to our team, get you better service, and create FAQ pages so the people don't have to ask the questions numerous times. They can find them on the FAQ pages. So that's happening. We've got a military hospital we'll be opening up in a couple of weeks. It's ready to roll right now, but we don't need it yet. So you move from fear to faith in the science. You move from panic to good personal responsibility. And then in every decision that you make, you move as best you can from selfishness, because we're all selfish. I'm selfish. You're selfish. We move from selfishness to sacrifice. And that looks, folks, in different ways to different people. But for instance, it means leaving some beans on the shelf at the grocery store. It means being cognizant that there are families who live in apartments and don't have a backyard, and give them first dibs on the park. It means modifying our behavior for the good of the community. I think overall, I'm so proud of the way that you're doing that. And together we will get through this with just as little casualties as possible, and we will, come out of it strong as a community. So, with that, Congressman, I turn it back over to you.
Thank you so much, Judge, for that and for your leadership and for your team's hard work. I know from some of our discussions, I can hear that you're getting more tired, but we have a lot of faith in you and want to thank you for everything you're doing for North Texas. And you're saving lives with the leadership you've shown. For those of you who are just joining, this is Congressman Collin Allred. We just heard from Dallas County Judge Clay Jenkins. If you want to get more information, you can visit my website at allred.house.gov/coronavirus. If you want to help Dallas County's response and Judge Jenkins' work, you can go to helpdallascounty.org and get involved there. And we have one more speaker from the Small Business Administration, Mr. Susheel Kumar, who will give us a quick overview on what we've made available for our small businesses.
Congressman, good evening. Thank you for having me. Basically, folks listening in, we have an economic injury disaster loan package, maximum loan amount of $2 million. The website has been streamlined. It's basically 5 pages that talks about very high level what your business did, what your revenues are, your cost of goods sold, nonprofits, contractors, businesses over 500 employees, business with less than 500 employees, and ESOPs and travel concerns and every gamut of business society that we could cover. Interest rates fixed up to 30-year repayment. Interest rate for private nonprofits is 2.75. Interest rates for small businesses, 3.75. Maximum repayment term of 30 years. No collateral for up to $500,000. Working capital of 6 months being put into the bank account as soon as it's approved. Funding is anywhere between 2 to 3 weeks. And when you apply on our website, even if you're turned down for a loan, an advance of $10,000 up to could be lent to your company. And if in case you're not approved, you don't have to pay back. This covers all areas of working capital. So your rent, your mortgage, your payroll, your vendors. The mindset is if you get the order to reopen your business tomorrow, then not only are your people paid and they're raring to go the next day, your product is paid and you are able to sell. So this pretty much is a turnkey scenario where you borrow, you pay, and you get your people ready to go out and work and ready to sell. In a nutshell, it's an economic injury disaster loan. Your first payment is due 12 months from now. There's a $100 UCC filing fee, no fees other than that, no cost to apply, no obligation to take the loan, no prepayment penalty, and we encourage everyone to apply. Appreciate your time, Congressman.
Thank you, Mr. Kumar, and Mr. Kumar will be on this call to answer any questions. Again, this is Congressman Colin Allred. If you have a question, you can press *3 to ask your question. Mr. Kumar was just talking about the economic injury disaster loans. We also have the Paycheck Protection Program, which is a guaranteed load program at the SBA for small businesses to cover the payroll during this crisis. And if employers maintain their payroll, the loan will be forgiven. And we can discuss that in more detail, or you can go to my website at allred.house.gov, and you can find the link there to get to our small business guide.
So we're going to begin taking questions now from folks that have called in as well as online. Again, I want to remind folks that you can press *6 to be added to the Congressman's newsletter. First, we have a lot of folks asking questions about the Texas Workforce Commission, about unemployment, about how to apply. We have folks asking online questions regarding this as well. But we have Darlinda Perkins from Dallas who's going to ask a question related to this. Darlinda, you should be live now to ask your question of the Congressman.
So you touched, hello?
Yes, Darlinda,
hello?
I can hear you.
Okay, so you touched on it a little bit before, but my question was, because literally since about Saturday morning, because they're open now on Saturdays, I just found out last week, I've been literally calling about 150 times a day, and this is no exaggeration, and I haven't been able to get in contact with them. So are they going to hire more customer service representatives to help with this time period, or what's going to happen with that? Because I know a lot of people like myself, we just aren't able to get through to them.
Darlinda, thank you so much for your question, and I'm so sorry to hear that that's happened. We have heard many stories like that, and my office has been in touch with the Texas Workforce Commission that does administer our unemployment benefits. And what we've been told is that they are working to expand their capacity, but that until they do, it's best to visit their website or call early in the morning or later in the evening when traffic is lower. What you can also do, though, is give my office a call, and we can try to contact them as well. You can find our phone number on my website at allred.house.gov, and you can give us a call, and we can try to get through as well. I've heard a number of these stories, and it's extremely frustrating. But we also understand that there are a lot of people who are applying, and I understand that there are some capacity issues there, but we're going to try and do everything we can from my office to try and work through that. And if there's anything that we can do to help you in this time, please feel free to reach out to us, and we will try and do whatever we can for you. And hang in there. Thank you so much for your question, Darlinda.
Okay. Next, we have a lot of people asking about the shortages in PPE, or personal protective medical equipment. Folks are asking about how they can help, or just questions regarding to the supply chain and issues related to this. We have Kevin from Dallas who has a question on this topic. Kevin, you should be live now to ask your question.
Thank you, Mr. Congressman. Yes, I've reached out to not only to the governor's office, Abbott, but to Clay Jenkins and to Mrs. Gates, saying that I've been able to secure product from China, 7 to 12 day lead time, air freighted in, and I'm able to get hand sanitizers, gloves, N95 face masks, face shields, equipment needed that y'all are saying that y'all need, and I haven't been able to get a response not only from Texas and anything, but I've also reached out to the East Coast, along the East Coast governors and on the West Coast governors. But since y'all keep asking for it, I'm asking y'all, how can I help y'all? Give y'all my pricing and say, hey, we've got an avenue to help y'all out.
Yeah,
I'll take that one.
Go, Judge Jenkins, do you want to? Yeah.
Sure. If you'll go to DallasCountyCovid.org, that's our new website that's out today. What happens is when you fill, and I don't know if you've done this, if you've gone to one of our websites and filled out the one-page document that takes maybe a minute, that then goes to the purchasing directors of the county, the city, and the hospital systems. They vet the source, and they're able to get back with those who go through that. If you're not familiar with that, and I know a lot of people are trying to help us or not, and we appreciate everyone's help, but if you're not familiar with that government process, that will really speed it up for you to just go to that new website, DallasCountyCovid.org, and fill out your sheet and start to go. We are now, if people can provide these services, and what happens, unfortunately, is this is what Dr. Zerwas at the state is finding as well. When it comes time to fill the purchase orders, it's not that people don't believe that they can get these things for us, but a lot of times, I'd say with PPEs, just about every time, when we get ready to fill the purchase order, somewhere along that Byzantine supply chain, we're just not able to get any PPE or get the PPEs from non-traditional sellers of PPE. Having said that, though, there are teams working to try to work with anyone to get PPEs from anywhere. So, they will vet that, and if any hospital or city or county in Dallas County, feels that after the vetting that would be a good avenue to go down, then they will definitely be in touch with you. So thank you for for your service and for as a citizen trying to help us with this very critical shortage.
Thank you, Judge. Thank you, Kevin.
Okay, so folks have a lot of different questions about the expanded unemployment benefits. I want to go to Heather French from Richardson, who has a question regarding financial assistance.
Hi, Colin.
Hi, Heather.
How are you doing? I had a question. I've heard a lot about the things for small business and such, but there are people like me that are self-employed, that are independent contractors and gig workers. What exactly is there? How do we go about things, and what is there for us?
Yeah. Well, thank you, Heather, and thank you for your friendship. I wanted to, there's two things. Number one, unemployment has been expanded for gig economy workers and self-employed. So it's possible that you may qualify for the unemployment benefits, and we can help you kind of walk through that. The Texas Workforce Commission will be the one that actually issues the unemployment checks and the benefits, but we can help you with that and help you understand that. On the small business side, on the loan side, if Mr. Kumar is on, I'd love for him to jump in and kind of fill in for how this would operate for independent contractors and the self-employed.
Thank you, Congressman. Ma'am, if you would go to our website, covid19relief.sba.gov, you'll find there is an economic injury disaster loan application. and radio button number 2, which is just a round button. And bullet point number 2 specifically addresses your independent contractor as your eligible entity, and you would seek reimbursement for those damages. And I don't want to use the word reimbursement, and more so addresses your economic injury, if you will, and just follow the process. And depending on your situation, you may get an advance of up to $10,000 and potentially more sums of money to address the severe economic disruption that the economy and the rest of us are facing.
Thank you, Mr. Kumar, and thank you, Heather, for your question. Please stay in touch with us, and we'll see if there's anything we can do to be helpful, and I really appreciate you.
Okay. So I just want to remind everyone, you can be put in line to ask a question by pressing *3, or you can sign up for the Congressman's newsletter by pressing *6. Next, we have a lot of people asking questions about testing. So next, I wanted to go to Ed, I believe for Dallas.
Oh, my God, yes,
Ed,
I'm
you're
here.
live now. Hello?
Okay. Hi, it's Ed from Dallas. I have a few questions about testing. One, how many have been tested in Dallas County? 2, why did it take so long to start in Texas? Number 3, can someone get tested later to find out if they had COVID-19? And a couple of things, Judge Jenkins, your Dallas County COVID is not great, but the guy wanted to know if he could help. He needs to go to the dallascounty.org. That's it.
Dr. Huang, do you want to take this one, or?
I can start with, in terms of the testing, we've been getting some of the, our Dallas County Health and Human Services lab was the first place to start offering testing, actually in the state, locally, and not at CDC. But we've had smaller capacity. The commercial labs have kicked in shortly after that. I think it's almost, I'd have to look at some of the latest numbers, but I want to say, actually, if you give me a minute, I can get some of the latest numbers. But it's, I think 6,000 tests that have been done around in Dallas. Again, there's been problems nationwide in terms of accessibility to tests, but that's certainly, there's been more labs being able to offer it, getting FDA approval, so those numbers are increasing. We've been doing the drive-through testing at American Airlines Center and also in South Dallas. And so those have been going on for now a couple of weeks with federal FEMA support and working with the city. So again, there's more testing now that's available through private clinic settings and commercially available. We've had our drive-thrus. We've had our public health lab that's been supporting some of the public health testing needs that have been going on. But, as we all say, there has not been as much as we've liked, and that's been sort of a national shortage of the accessibility.
Thank you, Dr. Wall.
I can tag on and just say that can you get tested afterwards? And the answer is, in the future, you will be able to. There are multiple companies as well as universities that are in the process of developing what we call serology. So that's actually a way that we can test whether or not you have formed antibody in response to the infection. And so those should be coming on market soon, if not, a couple have already arrived. And so that ability should really be in the near future.
Thank you, Dr.
And it's
Perl.
nothing. I did look at the numbers. It's close to around 4,000 that have been done thus far in the Dallas area that we have reported. But
thank you, Dr. Huang. I would just add that Dallas County was the first county in Texas to be able to test for the coronavirus, and the limitations on their testing capacity are not the county's fault. This is a federal failure. We have failed from the very beginning in developing our own tests that didn't work, not accepting the World Health Organization's tests that had been used in other parts of the world, and not marshaling all of our resources to make sure that we have the capacity and the testing supplies, such as reagents and PPE equipment, to be able to test on a large enough scale. That is ramping up. As Dr. Huang mentioned, there are private labs that are coming on board and increasing our testing capacity, but we will not be able to truly give confidence to the American people, to North Texans, on where we are in terms of fighting this virus until we dramatically increase our testing capacity. And that's something that's one of my top priorities. And I want to thank Dallas County Health for the work they're doing, Judge Jenkins for the work he's doing. We have to make sure we're supporting them at the federal level. And again,
well,
this is go ahead, Judge.
And you are supporting us, Congressman Allred. You're doing a tremendous job, as is Congresswoman Johnson here, in helping us to find PPEs and to cut through red tape, and I can't thank you enough for that. And also our regional FEMA guys, all of the regional partners, same people that went through police shooting, Ebola, West Nile virus, floods and tornadoes with us. They're doing the same great job that they normally do. The problems, to put it bluntly, are at the top of the federal chain, and just not really releasing people to do the work that they normally do.
Thank you, Judge. And again, for those of you who are just joining this call, this is Congressman Colin Allred. You can press *3 to ask a question, and I think we'll take our next question now.
So we've had a lot of people ask about things like the direct payments that Congress is going to be sending out, a few folks online as well. So next I want to take Elias from Garland. Elias, you're live now to ask your question.
That's a good question.
Elias, are you there?
Okay, so Elias's question, as my understanding, was who qualifies for direct payments and how soon will they be going out?
Well, thank you for that question, Elias. Let me get my paperwork here. So in order to get a direct payment, you do have to have a Social Security number. And as I mentioned at the beginning of the call, the payments will be up to $1,200 for an individual and $2,400 for joint filers, as well as an additional $500 for each child in the household. The timing of this, for those of you who are interested, is that if you are receiving direct deposits for your tax refund, you will likely begin to receive direct deposit payments beginning the week of April 13th. Physical checks will be mailed out a couple of weeks after that, and they will be beginning with low-income filers and then going all the way up. For those above $75,000 incomes for an individual or $150,000 for a household, there are reductions up to a certain level, and you can visit my website, allred.house.gov, and we can try to help you figure out how much you will receive. And so those are the criteria for the direct payments. There are some loopholes that were not covered, such as adult dependents, that I personally want to see us cover in our next bill that we will be hopefully addressing soon. And I recognize that this is particularly for the disabled community. This is a big oversight, and this is something that we are working on and that I'm aware of. If you have any questions about how this program is going to work, please feel free to contact my office, and we will try to provide any answer we can.
So next we're going to go to a question regarding small business help. I have Mario from Dallas. Mario, you should be live.
Yes. Hi, Mr. Allred. Hi, everybody. My question, I think part of it was answered a little while ago, but my wife and I, we own a janitorial business here in Dallas, and then of course most of our customers are closed. We service mostly retail companies. They're all closed right now since March 11. And then so we have not done anything in regards of creating any revenue. Of course, we have rents due for the warehouse and the office, and I heard about the help with the payroll for the employees, and also I wanted just to check for the future because we of course will be again out of commission until hopefully April, the end of April, that this thing might curb a little. Where do I or how do I talk to somebody or check with to getting some help on revenue for when we start the operations, being able to operate again, to buy the supplies we need to do the cleaning, to get payroll going, pay rent, and that?
Well, thank you, Mario, for your question. There are several different pots of money that you can get access to. There's the economic injury disaster loans that I'm going to ask Mr. Kumar to, again, just discuss quickly. There's the Paycheck Protection Program that you mentioned, which is aimed at keeping your workforce employed and reimbursing you for that. And if you are able to keep that workforce or to hire back your workforce in the covered period, that loan is entirely forgiven. And there's also the Small Business Debt Relief Program related to existing small business loans. So, Mr. Kumar, if you could just jump in and discuss the economic injury disaster loans.
Well, of course. Senor, I would have you apply at covid19relief.sba.gov, and you would click the very first button. If you're an individual sole proprietor, you would do so. And once you apply with us, within a couple of days, if you're eligible, up to $10,000 worth of payroll expenses will be put into your bank account. And after that, economic injury disaster loan amounts equal to your working capital for 6 months will be potentially be approved. So our program provides for the purchase of material, rent, mortgage, payroll, and anybody else that you might owe, and help you with the liquidity that you're seeking. Thanks for your question.
Thank you, Mr. Kumar. And I'll discuss the Paycheck Protection Program because it's a guaranteed loan program. So this will be administered by your bank of choice if it's a SBA-backed bank. And so you can go to my website to find out more information about that aspect of it. It's allred.house.gov/COVID-19 small business. We have a guide there that you can download and it can walk you through. And also, of course, you can give us a call. But I want to quickly go into what the purpose of the Paycheck Protection Program is, because the idea here is to help employers maintain their payroll, and if they're able to do that or to hire back their staff that might have been laid off or furloughed during the covered period, the loan will be forgiven. And so what we're trying to do here is keep money in the pockets of your workers and also keep your doors open as well as we can. And so the program includes forgiveness for up to 8 weeks of payroll based on employee retention and salary levels. There's no SBA fee, and there are at least 6 months of deferral of any payments, and it can go up to a year. So small businesses and other eligible entities can apply if they've been harmed by this crisis if the harm occurred to them between February 15th of this year, so going back to February 15th, all the way to June 30th. And so the program is retroactive all the way back to February 15th in order to help bring workers who may have been already laid off back onto the payrolls. And so the loans are available through June 30th, 2020. And so what type of businesses can get this loan? You can get if you're a small business or a 501c3 nonprofit, a 501c19 veterans organization, or there are some other smaller classifications that we can help you with and that are listed on my resource guide. And individuals who operate a sole proprietorship or an independent contractor are also eligible for this. So if you are self-employed or if you are a gig economy worker, you're eligible for this as well. And any business that employs not more than 500 employees per physical location, so this is for franchises, you also would be eligible. And the loan size, there's a maximum loan up to $10 million. And the loan size is calculated in different ways, and you can find all the ways it's calculated in our resource guide. What costs are eligible for this payroll protection program? Compensation of any kind, salaries, wages, commissions, or similar compensation or payment of cash, tip, or equivalent is eligible. Payment of vacation, parental, family, medical, or sick leave is eligible. Any dismissal or separation payment is eligible. Payment required for any group health care benefits are eligible. Payment of any retirement benefit is eligible, and payment of any state or local tax assessed on the compensation of your employees are eligible. And so we have a whole lot of information on this program on our website, but this is a new program, and it's one that is going to be very important. We have over $350 billion put aside for our small businesses to try and get them through this period. And if we can help you, Mario, please feel free to give my office a call. You can go to my website again, allred.house.gov. To download the small business guide, you can go to allred.house.gov/COVID-19 small business, and you can download the guide that I'm looking at right now, and it can help you as well. And thank you so much for your question, and thank you for having a business with us in North Texas.
Okay. We're reaching near the end of our telephone town hall here. I want to remind everyone you can press *6 to be added to the newsletter. If you are in the queue or you haven't had a chance to ask a question, you will be able to leave a voicemail and we'll be able to get back to you. But next year we had a lot of people ask about the virus, how it's transmitted, and various questions like that. So we have Ms. Sheila Cunningham from Dallas. Sheila, you are live to ask your question.
Good evening, everybody. I was listening to CBS News yesterday, and I heard them say, it was via KRLD radio, I was actually in the car, they said the virus can travel more than 6 feet, and that the 6 feet measurement was based on 1930 research. And I'm just wondering if either Dr. Huang or Dr. Perl or even Dr. Jenkins can speak to that.
So this is sure. So it's actually true that the 6 foot research is old research. I don't know if it's 1930s. There's certainly data from the 1970s also that supports it. But the 6 foot rule is well established, but that rule actually comes from real clinical settings. So this is data that we've actually accumulated and worked on from outbreaks and other types of settings to know how respiratory viruses are spread. So that's how that data comes. The data that you're referring to is actually from a study that is in the process of being published. So it's not yet been reviewed critically. But what we know is that you can take any of these respiratory viruses, and if you put them in a hospital setting where we are doing certain things to patients that might cause the virus to be aerosolized, that it can go farther than 6 feet. This is not something that we commonly see outside of a healthcare setting. It's really a unique feature. So from our point of view and from all of you listening on the radio, your risk is really this, within 6 feet. And the aerosol issue is really something that we see in very special settings. Does that help?
Thank you, Dr. Perl. That's very helpful. Dr. Huang, do you want to add anything?
No, I think you covered it well. Dr. Perl has great expertise in this area.
Yeah, she does. And thank you so much, Dr. Perl and Dr. Huang, for joining us and for your work in your saving lives. And we just can't tell you how much we appreciate you. I think all of us are gaining an even greater appreciation for everyone in the healthcare space. And thank you so much for being on this call this evening. Mr. Kumar, thank you as well for joining us. And we will be doing everything we can, working with you to help all of our small businesses here in North Texas. I understand how difficult a time this is, and I thank you for working late. We've been on several calls together, and I want to thank you for making yourself so available to me and to the people of North Texas. Judge Jenkins, if you're still on, is there anything else that you want to share?
Yeah, I had to figure out how to get you off of mute, Colin. Sorry about that. Congressman, sorry about that. The last thing I would say, and please forgive me if I seem short. I don't mean to be short with anyone. It's a lot of long hours. We can get through this together, and I think it's important what you're doing, Congressman, to let people give their feedback. And I want to just encourage you all to please. It's been frustrating, I know. Our switchboard's overrun. Our email addresses are overrun. Hopefully, with this new website, which is rudimentary and will be improved, we'll be able to better communicate with you. But let's just all, work together to support one another, to support our community. And, this community is so great at giving grace to one another, but please give grace to yourself. We're all going through a tough time. And so I just encourage everybody to have good self-care. I'm probably preaching to myself as much as I am to you on this, but get some sleep. Get some exercise, spend some meaningful time with family. It's going to be a long situation, unfortunately. So we need to just get through it as best we can, and know that Congressman Allred, the doctors on this call, are all fully committed to working together and working with you to save as many lives as possible. Thank you.
Thank you so much, Judge, for your leadership and for being available tonight. I know how hard you're working, and I'm sure you are. You need to get some sleep, and so I want to thank you for everything that you're doing for Dallas and for North Texas. And really, I think across the country, people are seeing your leadership, and it's just it's been incredible. So thank you so much, sir, for what you're doing. I will finish up this call by just saying that, as the judge said, we are all doing everything we can at the federal, state, and local level to try and get us through this incredibly difficult period. And as the judge said it well, this is an extremely anxious time. It's a very difficult time. People are worried about their family's health. They're worried about their own income. They're worried about their businesses. And I recognize that this is one of the greatest challenges that we have faced. And it's going to take all of us together to beat this virus. We have put in place the policies to try and give us the best chance possible to do this and to get back to as normal a life as we possibly can. And as much as this disruption is making it difficult for us, it is saving and will save hundreds of thousands of lives. Our commitment to the social distancing and to the policies that Judge Jenkins and now Governor Abbott have put in place will save the lives of our family members and of our neighbors, and will save the lives of our healthcare workers who will be on the front lines taking care of the folks who will need to have a ventilator, who will be in the emergency room. This is not a time for politics of any kind. There are no Republicans or Democrats when we're dealing with a crisis like this. And I'm committed to working across the aisle and working with anybody we possibly can to get through this period. And I know from what I've seen in North Texas, that's the spirit that we have together as a community. And I want to echo Judge Jenkins in saying how proud I am of our community for the way that we've responded to this, the incredible stories of people going above and beyond for their neighbors and for their families, the inspiring stories that we've seen. It's just a great example of who we are in North Texas and who we are as a country. And I think that spirit and that idea of community is what's going to also get us past this virus and hopefully carry over on the other side into us all understanding how interconnected we really are. I think that's one of the lessons that we will all learn from this pandemic, is just how much what happens down the street affects us too. And so this is our second telephone town hall that we've held in the last couple of weeks. We also held an in-person town hall at Dallas County Health and Human Services. We will be holding more town halls and using every tool we have to get the information we can out to you. You can, of course, again, go to my website to learn more and to get access to all the website links that I've talked about on this call at allred.house.gov/coronavirus. And, of course, you can also go to the Dallas County websites that Judge Jenkins mentioned. helpdallascounty.org is one that I know about, and there are others as well. And we will get through this together. I want to thank you all so much for joining this telephone town hall, and hope to talk to you very soon.
Okay. Thank you everyone for joining us. I just want to remind everyone to stay on the line for just a few moments, and you will be able to leave a voicemail if you didn't get a chance to answer the question. Again, thank you so much.